we call for the next.
Session of COVID-19 and IBD.
Yes. Is anybody from the chairperson?
دكتور أسامة ازيك؟
دكتور مجدي.
دكتور أسامة أنا دكتور أيمن يسري.
أهلا أيمن، إزي حالك؟ أخبارك إيه؟ الحمد لله على السلامة.
أخبارك إيه؟ الله يسلمك.
كله تمام والله الحمد لله.
الحمد لله.
اتفضل يا باشا. Of course. Well, go ahead.
I'd like to start this session thanking the Egyptian Society for Inflammatory Bowel Disease for arranging this successful virtual conference. This is actually one of the positive aspects of COVID-19. This session is going to be about COVID-19 and IBD. And one of the positive aspects of COVID-19 is the evolution of telemedicine, as Professor Hussam Ghunaim was just explaining the telemedicine and how we made use of it and how we communicated through telemedicine and the different aspects of telemedicine. And now we are doing quite successful conferences and communicating successfully in spite of not being allowed to meet face-to-face in conferences. So let me start this session, which is about COVID-19 and IBD. And the first presentation by Professor Ayman Shamsiya from Alexandria, what to tell your IBD patient with COVID-19.
السلام عليكم. حضرتك سامعني دكتور ايمن بيه؟
سامعك. Please share your screen.
اوكي بيه، مع سيادتك. معايا بيه كده واضح الشاشة عند حضرتك؟
لا لسه السكرين مش شيرد. Okay, it's being shared now. Okay, go ahead.
اوكي، مع سيادتك يا فندم. بسم الله الرحمن الرحيم. اشكر اللجنه المنظمه دكتور اسامه عباده واللجنه والجمعيه المصريه ASIBD. والنهارده ان شاء الله I'm gonna be talking about COVID and IBD. What to tell your patient about this? First of all, what is COVID-19? What is coronavirus? Since we all know the coronavirus family that can affect both humans and animals, and in humans, most of them are commonly encountered and will cause mild symptoms, such as the common cold virus, while other types of human strains can be more severe. We all know about the SARS, the severe acute respiratory syndrome, or SARS-CoV, and the MERS, Middle East Respiratory Syndrome, or MERS-CoV syndrome, that were extremely fatal in the past few decades. A new coronavirus affecting humans, which was named SARS-CoV-2, which was identified by the end of 2019. SARS-CoV-2 causes the COVID-19 syndrome, and reported COVID-19 cases have ranged from mild to severe, including fatal cases. This is the COVID virus, or this is the coronavirus, the newly diagnosed COVID-19 virus. The clinical manifestations of COVID-19 range from very few or very mild cases with mild fever, shortness of breath, and cough. Some other causes have chills, muscle pains, headache, and diarrhea, and many patients have experienced bronchopneumonia as a complication of that virus. Deteriorating lung functions, need for ventilation, and actual death were complications reported from this case. As of the 11th of March 2020, the World Health Organization declared COVID-19 as a pandemic. What is pandemic? The term pandemic is used when a virus has spread beyond the country of origin. And we all know in this case, it was China to two or more countries, and that affects a large number of people. The WHO emphasized that the word pandemic relates to the spread of coronavirus, not its severity or deadliness. We all know that coronavirus or COVID-19 is not more fatal or not more lethal than the SARS or the MERS types. This had led the implementation of restrictions of flights, restrictions of gatherings, restriction of even daily activities. The SARS-CoV virus is thought to be spread through contact with an infected person, the viral respiratory droplets, cough or sneezing, or contact with an infected surface or objects with the patient's secretions. Some, let me say, some new terms or terminology have been implicated. Health practices, these are preventive actions that you take to protect yourself from exposure to the virus and prevent the spread of the disease. The Center of Disease Control, CDC, recommends avoid having close contact with people who are sick or suspected to be sick. Don't touch your nose, eyes, or mouth if you have not washed your hands. Wash your hands with soap and water for at least 20 seconds every 15 minutes. If soap and water are not available to you, use a hand sanitizer that contains at least 60% alcohol. And many communities have implemented social distancing, including canceling public events and encouraging remote works like what we are doing now. If you are feeling ill or you think you may have been exposed to COVID-19, stay home, cover your cough or sneeze with a tissue and throw it in the trash. Clean and disinfect frequently touched objects, including the phone, the keys. Contact your doctor if you are feeling ill. Wear a face mask if you are showing symptoms. Wearing a mask will eventually reduce the potential spread of virus to others. Social distancing. Social distancing refers to actions to be taken by cities, states, and governments to prevent the spread of infections between them and between countries. Social distancing steps include limiting large group gatherings like sporting events, shows, and of course conferences, and closing public buildings like museums. Business may also take social distance steps to protect their employees by closing offices or encouraging remote work. This is an example of social distancing. Flattening the curve. الترم ده اتشهر جدا. Flattening the curve refers to using protective practices like social distancing to slow the rate of COVID-19 infection. These measures are intended to help hospitals to have room, supplies, and enough doctors for all patients who need an in-hospital care. What about our patient? What about IBD patient, especially they are immunocompromised or immunosuppressed? Every IBD patient knows the challenge of making the decision to stay home or to postpone work or school, and the difficulty of not going to a gathering, a movie, or a dinner because of IBD symptoms. And with the spread of coronavirus, it has become even more challenging for patients to even practice their daily activities. Anyone who is immunosuppressed or immunocompromised is at greater risk of respiratory infections than the average person. We all know this, including IBD patients, whether or not they are on immunosuppressive treatment or not on. Guides for IBD patients. First and the foremost important, if you are on a medication that suppresses your immune system, you don't stop taking your medication by yourself. We know that everything going on, this might be your first reaction. المريض أول ما يسمع إن في فيروس هيوقف الدواء بتاعه يقول لك ده دواء بيبوظ المناعة. But this is absolutely not an option. Stopping any sort of treatment plan without direct guidance from your healthcare provider is dangerous and may leave you in hospital. اللي هو آخر مكان الواحد يرغب في البقاء فيه في الوقت الحالي. It's the last place you want us to be on right now. Because please continue to take your medication and implement extra precautions, even more than the general population, in your day-to-day activity until the threats have passed. 4 حاجات ال CDC recommends. 4 حاجات دول مهمين جدا جدا لل IBD patient بالذات. Wash your hands. وحطها كده, wash your hands like a surgeon. Cover your mouth and nose. Stay home and avoid anti-inflammatories if not in need. What about washing your hands? Washing your hands every 15 minutes. This is the step safeguard after toilet use, before eating, after playing. ال 5 steps دول مهمين جدا جدا to be بالظبط زي تعقيم الجراح قبل ما يدخل العمليه. بيغسل ايده بايده الثانيه ثم يدعكهم ببعض جامد ثم يسبريد على الحد المرفق ثم يوش ببلنتي اوف ووتر ثم يحاسب الميه على ايده فتره طويله ويجفف بكوعه او يقفل التاب بكوعه مش بايده. You need to be washing your hands regularly. If you leave the house, بالرغم ان احنا ما نقولش كده, wash your hands. If you sneeze, wash your hands. If your cat or dog sneezes, wash your hands. اخر مره حضرتك نظفت الموبايل امتى؟ ده الوقت اللي المفروض انك تنظفه كل شويه. This goes also for your car keys, for remote controls, your doorknobs and your delivered package. الحاجه اللي جايه من السوبر ماركت، اي حاجه اتسلمت لك او حد غيرك مسكها نظفها. Cover your mouth and nose. Make sure never to use your hands to cover your face when you cough or sneeze. ما تغطسش في ايدك. Always use the crook of your arm. عايز تغطس اعطس في جنب كوعك كده بالظبط. It is important to maintain 1.5 meter or more from anyone, especially if they cough or sneeze. ثالث حاجة, stay home. If you are immunocompromised, please stay home. Physical distancing is really the most effective way to ensure your safety. The more you stay inside, the less likely it is that you can get the virus from any other. And lastly, avoid anti-inflammatories. Although this is still controversial, but WHO has recommended against using these types of medications with the exception of paracetamol. And there has been some evidence that using non-steroidal anti-inflammatory medications may increase complications in cases of COVID-19. Should I still be going to my infusion center? لو أنا مريض IBD وباخد infusion biologics أو infusion steroid أو أي infusion, should I go in time? If you receive your medications by IV infusion, yes, but with a few exceptions. That if you are encountering acute symptoms or not feeling well or showing manifestations, please reschedule your appointment with your caregiver. Once again, if you are on biologic, biosimilar, or immune suppressant, or any other medication that are in place to help you manage your chronic disorder, it is imperative that you continue to take your medications. Failure to do so could result in hospitalization and put you even more at risk, more than continuing the drug. دراسه ظريفه جدا اتنشرت في الدوريه المرموقه جاسترونترولوجي في 6/2020 على البيشنتس تقريبا 500 بيشنت 525 بيشنت تابعوا الكلينيكال كورس بتاعهم لما اتصابوا بكوفيد 19 لقوا ان تقريبا النيد فور هوسبيتاليزيشن كان اراوند 30% 31% 3% كان الديث ريتس. كان الريسك فاكتورز اوف سيفير كوفيد 19 كان الانكريزنج ايج طبعا الاولد ايج اذر كوموربيديز كاردياك او رينال سيستميك كورتيكوستيرويد use of 5 ASA medications but astonishing was not anti-TNF treatment. And the maintaining remission with the steroid sparing treatment is important in managing IBD. ده كان الكونكلوجن بتاعهم although this is through this pandemic. دي كانت الدراسه منشوره من مالتي ناشونال من تقريبا 33 دوله. البيشنتس كان 525 بيشنت 33 countries. الكونكلوجن كان increasing age comorbidities corticosteroids were associated with severe COVID among patients with IBD, although a cause relationship cannot be definitely established. Notably, TNF alpha antagonists didn't appear to be associated with severe COVID-19. This was my last slide, and thank you.
Thank you very much, Professor Ayman, for a very comprehensive presentation. I'd like to stress 3 points that the patients usually ask. They usually ask, am I more susceptible to being infected with COVID-19? And the second question, if I get COVID-19, will it be more severe than the normal person? And the third question is, what about the mortality? Is it higher because I have an IBD or not? You have answered these questions, but I'd like you to stress them again.
Of course, شكرا حضرتك للبروفيسور ايمن بيه. Of course, patients with IBD immune suppressed or immune compromised patient, they are more at risk of contacting COVID from any infected person than normal healthy or healthy. عشان كده احنا بننصحهم to more stay home وما يعرضش نفسه لاي حد ولا مخالط. حتى ايفن الخروج للسوبر ماركت، الخروج للفسحه او نزهه تعتبر انشطه غير مرغوب فيها حاليا. الحاجه الثانيه طبعا
بس عايز برضو يعني يبقى في reassurance للبيشنت لان الانسيدنس of COVID-19 in IBD patients is not higher than the normal population. يعني الدراسات اللي اتعملت على طبعا اعداد قليله،
تمام،
الانسيدنس of COVID-19 infection in IBD patients is not higher than the normal population. وحضرتك وضحت كمان نقطه مهمه جدا ان السيفيريتي مش اكتر من النورمال بيشنت والمورتاليتي برضو مش اكتر من النورمال بيشنت.
انا هدفي طبعا في عدم وجود الكوموربيديز الثانيه.
انا هدفي طبعا انا هدفي ان reassurance of the patient you are not going to get a higher mortality, you're higher risk of acquiring COVID-19 in spite of being immunosuppressed. شكرا دكتور ايمن،
شكرا
على المحاضره الجميله. وفي حد تاني من التشير بيرسونز يحب يقدم؟
اهلا بسعادتك دكتور ايمن بيه، واحنا عايزين نشكر الاستاذ دكتور اسامه على دعوته وعلى الكونفرنس القوي بمشاركه اساتذتنا كلهم الحقيقه.
كلنا بنشكر يا فندم.
شكرا. Next speaker for an important subject, what to do for your IPD patient with COVID, Professor Khalid Ali, Alexandria University. Welcome, Dr. Khalid.
دكتور اسامه ودكتور خالد اعتقد مش متاح ولا موجود؟
انا ما بلغنيش احمد عاصم حاجه، وهو اعتذر يبقى اللي عليه الدور.
دكتور احمد لاني هو اللي هيبدا دلوقتي، يعني دكتور خالد
تمام
يبقى تمام.
سامعني يا دكتور ايمن؟
ايوه دكتور احمد لاني هيبدا دلوقتي.
ايوه سامعني يا دكتور ايمن؟
ايوه دكتور احمد
انا سامع ايوه.
طيب اوكي السكرين شير ده.
اوكي والدكتور احمد هو اللي هيقول دلوقتي، اتفضل.
ايوه كده السكرين اوكي؟
اوكي بيوضح.
اتفضل.
بسم الله الرحمن الرحيم. في البدايه بشكر اللجنه المنظمه والاستاذ الدكتور اسامه عباده والدكتور ايمن والمجموعه اساتذتنا كلهم. هتكلم عن الاندوسكوبي اند كوفيد 19. SARS-CoV-2 or novel coronavirus or COVID-19 دي الاسماء اللي تعرفنا عليها بالفيروس has become a global pandemic. Human to human transmission occurs through respiratory secretions, aerosols, feces, and contaminated environmental surfaces. Transmission can occur in both symptomatic and asymptomatic individuals. The viable virus particles can be detected in the aerosols up to 3 hours after aerosolization and up to 3 days on the surfaces. The risk of infection to healthcare workers is significant. In one of the earliest documentation of infection in Wuhan, 29% of the patients, 40 out of 138 were healthcare workers. وزي ما احنا شايفين دلوقتي في الواقع كمان النسبة اعتقد انها بتفوق هذه البرسنت يعني. When performing endoscopy, it seems inevitable that healthcare providers will be exposed to either respiratory or gastrointestinal fluids from the patient. Thus, adequate protection of healthcare providers is now critical. The potential mode of transmission of SARS-CoV-2 during endoscopy, the virus characteristics and its transmission make endoscopy a potential route for infection. Possible route of SARS-CoV-2 transmission include person-to-person, respiratory droplets, aerosols generated during the endoscopy, and contact with contaminated surrounding and the body fluid. Additional care must be instituted when handling the blood samples or the specimen because the virus has been detected in the blood of COVID-19 patients. طيب, is endoscopy an aerosol generating procedure? All endoscopic procedures should be considered aerosol generating procedures. Coughing and itching can occur during upper endoscopy generating aerosols, but a patient undergoing colonoscopy may pass flatus, which is also known to disseminate the virus to the nearby surrounding. The WHO has published an extensive guideline on the rational use of personal protective equipment for COVID-19 and provided specific instruction for healthcare workers performing aerosol generating procedure on the patient with COVID-19. These include the use of respirator N95, FFP2 standard or equivalent, the gown, the gloves, the eye protection, and the apron. طيب, ازاي بيحصل السيرفيس contamination during the endoscopy? Patient contaminated fluid often splatter when inserting or removing the accessories from the endoscopic working channel. مجرد ما بنفتح الاندوسكوبيك working channel بيكون في splatter invisible, ده ممكن يكون بيحمل الفيروس particle. وكمان during adjusting the air and water bottom, سواء شلنا الاير اند ووتر او الفلويد اللي بتطلع من خلال الاوبننج, retrieving the tissue from the biopsy bottle, and while performing the pre-cleaning where the patient's saliva can contaminate the pillow, the bed, and the stool mixed with water often drips to the bed during colonoscopy. Contamination of the room used by the patient with COVID-19. extensive environmental contamination can occur from the patient with COVID-19. The positive virus particle was detected from various locations around the patient room, including the patient bed, the sink, the bathroom, the light switches, the doors, and also positive samples were found in the shoes, the stethoscope of the staff existing in the patient room, and also from the computer, the mouse, the keyboard, the printers, and the remote control. يعني لو عيان COVID-19 دخل الأوضة ممكن يلوث كل حاجة في الأوضة من الحاجات اللي قلنا عليها. Our challenge, the goal is to attain the 0% infection rate among the healthcare providers while providing the essential services to the patient. For the GI community, the key element will be to prevent the exposure during an endoscopic procedure and the outbreak continue to occur. As the outbreak continue to occur. The suggested general measures وممكن طب دي حاجات suggested وممكن كل واحد يجود او يضيف عليها. Being well prepared is the best we can do to reach our zero contamination goal. We have to prepare, to plan, to train, to practice, to repeat again, and make the team ready. Ensure the presence and the performance of fit testing N95 respiratory mask for all healthcare providers. The FFP2 standard or equivalent, impermeable gown, gloves, apron, eye protection, and consider boot covers during ERCP. وللاسف لسه لحد دلوقتي صور زمايلنا على الفيسبوك اللي عاملين حاجات وكده برضو لسه بيتلبس السيرجيكال ماسك في اوض المناظير وده من الايه من الحاجات اللي ممكن تبقى بيرميبل للفيروس بارتيكل وممكن ما يحميش. احنا اتفقنا ان اقل حاجه ال N95 او ال FFP2 لما دورت برضو على الفيس شيلد ما لقيتلوش دور قوي. هم كاتبين اي بروتكشن بالجوجل اكتر من الايه من الفيس شيلد. طيب نمرة 3 follow the WHO recommendation for the PPE and teach the staff the correct consequence of gowning up and down through teaching videos and diagrams. يعني اللبس احنا نقلع هدومنا ليه طريقة معينة المفروض نعلمها للتمريض وللستاف وهكذا. Create a workflow to provide a clear job description and clarify the authorities with the backup plans. يبقى في ليدر معين والباقي حواليه ومش كل واحد ياخد القرار وهكذا. Separate the workflow to minimize the cross contamination. For example, consider dividing the clinical workforce into 2 teams. دي شرحينها برضو ان احنا لو سنتر كبير او كده المفروض يقسم التيم ورك ل 2 teams وما يقابلوش بعض. In the staff lounge or the eating area, we allow sitting in one direction, thus preventing the infection from face-to-face transmission. يعني ما نقعدش في وش بعض. The bathroom is a potential site of transmission. Ideally, the patient and the staff bathroom are separated and disinfected frequently. The staff should take additional precaution to prevent contamination through mobile phone, computer, printer, the chair, and stay at least 6 feet from any another. Set up the reception bay to screen and stratify the risk of COVID-19 infection of the patient before allowing them to enter the waiting area along other patients. يعني نعلم اللي موجود على الستاف سواء التمريض او المساعده او السكرتاريه انها تقدر تلقط بسرعه عيان الكوفيد 19 قبل ما يبتدي يقعد في الاوضه وينتشر المرض من خلاله، من خلال قياس الحراره ومن خلال taking short history about acute respiratory illness ومن خلال مثلا لحظه واحد بيكح واحد شكله مريض شكله سخن وهكذا. Notify the staff with the correct method of hand hygiene. Require all the staff to have daily measurements of the temperature before starting the work. We limit the number of healthcare providers in the endoscopy suite to those essential for the performance of the procedure. يعني مش كل الناس تخش أوضة المنظار. And finally, with the availability of RNA testing against COVID, point of care testing is patient presenting for the endoscopy may facilitate more accurate risk stratification. ولو كان في فرصة ان احنا في المستقبل يتعمل PCR لكل العيانين اللي داخلين المنظار ده طبعا يبقى افضل ويحمي الدكاترة ويحمي الستاف بتاع اللي هيشتغل في المناظير. دي سريعا كده recommendation from various gastrointestinal societies، وهنلاقي ان الامريكان واليوروبيان والانديان تقريبا متفقين بنسبه 100% في كل الريكومنديشنز بتاعتهم. فبالنسبه للبري سكريننج، للامريكان قالت all patients with high risk symptoms should be screened and procedure should be postponed if possible. اليوروبيان قالت all patients should be screened per local human resources and policies and temporarily postpone the elective procedure. والانديان برضو قالت all patients should be screened prior to the endoscopy. بالنسبه للكلاسيفيكيشن اند سكيدولينج ذا بروسيجر، هندخل مين ومش هندخل مين، الامريكان قالت ريسكيدول ذا الكتيف نون ايرجنت بروسيجر، يعني لو حاجه نون ايرجنت اجلها شويه. اليوروبيان برضو نفس الكلام، ريسكيدول ذا الكتيف نون ايرجنت بروسيجر، والترياج should be applied to the health professional. والانديان قسمت بقى المناظير لامرجنت وارجنت. الامرجنت اللي هي لايف سيفنج زي الابر ولور جي اي بليدنج او الامباكتد فورين بودي او الكولانجايتس. اما الارجنت اللي هي الكونديشنز اللي هي ارجنت بس ممكن تتعمل في خلال شهر، زي مثلا بروسيجرز على جي اي تي كانسرز او نيوتريشنال سبورت او هكذا. السكريننج اون ارايفل تو ذا اندوسكوبي يونت برضو الثلاثه متفقين نفس الكلام. الامريكان قالت pre-screen all patients for high risk exposure or symptoms, history about the contact, travel to high risk areas or symptoms should be asked. هنسال العيانين انت سافرت في خلال ال 14 يوم اللي فاتوا او جاي من سفر، طب عمل خلطت في حد من اهلك كان عنده كوفيد او هكذا. اليوروبيان قالت triage the patient and the staff based on the symptoms. low risk patient اللي هو no symptoms و no travel history and no contact to COVID، يبقى ده low risk. الهاي risk positive symptoms with no travel contact history. positive symptoms such as contact travel والcontact history او travel history ده يبقى high risk group. الانديان برضو نفس الكلام، قالت all patients should be considered low risk اللي هم مين؟ اللي هم no symptoms و no travel history و no contact history with COVID-19. ودخلت بس زياده عن اليوروبيان، دخلت intermediate risk. intermediate risk اللي هي ايه؟ symptoms but no contact or travel during the last 14 days. absent symptoms but contact for travel present. اما الهاي ريسك فهي زي ما قلنا symptoms وترافل هيستوري او كونتاكت مع عيان كوفيد. طيب البيرسونال بروتكتيف ايكويبمنت برضو الثلاثه متفقين نفس الكلام، ان all the staff should be
دكتور احمد
ايوه معلش النت
خلاص.
قاطع، حضرتك سامعني؟
سامعينك بس بقى نعمل سمري عشان ايه
خلاص احنا في اخر سلايد. السبيشال جروبس بقى خلاص بالنسبه للبي بي اي اتفقوا ان هو كل الناس الجروب اللي في اوضه المنظار لازم يلبس البي بي اي الثلاثه جروبس. والفولو اب برضو قالوا ان الفون فولو اب up to 7 to 14 days after the procedure، يعني بعد ما نخلص المنظار لازم نفولو اب للعيان، هل ظهر عليه اعراض، هل سخن، هل كذا. طيب والسبيشال جروب اللي هي اللي قال عليها الدكتور ايمن اللي هي البيشنت اون ذا immunosuppressive agents، وهيكملوا ولا مش هيكملوا المحاضره اللي قال عليها الدكتور ايمن. ثانك يو فيري ماتش، شكر جدا.